Good morning, live viewers and replay viewers. This is Dr. George Kosmides. Redondo Beach office today. Good morning. Let me close the door. For those of you, I'll wait for you to come on in. Hey, interview marketing. Hey, Jeff, thanks for joining. Thanks. My wife is on. Warrior4608. Thank you. Trish, hi. Hey, Jeff, I'm liking what you're doing. I'm very, very proud of you, man. You're doing phenomenal. TV viewer, Mayhem. Hey, there's my wife. Hello. So my wife has never seen this before. So for those of you that are new, my name is Dr. George Kosmides. I'm a doctor of chiropractic in Redondo Beach. I also do functional medicine and teach diabetes education to doctors here in the state of California. I've written several books. My latest one is Life Without Diabetes, and I have a 12-week, but far longer than that, lean body program, leanbody360.com. I don't know Taylor Swift, but what today's scope is basically on my medical issue with all my degeneration in my spine from all my accidents. So I'm going to show you the procedure I'm going to have done tomorrow. It's called manipulation under anesthesia, and I'm going to show you my films, and I want you folks to consider this possibly if you have similar problems as me, because it's an unknown procedure. Hey, Lucretia, but I'll explain it to you in my films. It's hard to, you're in Turkey, hey, it's hard to explain like this, but I'm going to explain it. I'm going to show you some basic things and show you why. So if you're having bad arthritic problems and you're considering, good morning, you're considering spinal injections or fusion, this may be an option. Okay. Let me go through this with you. So here's my cervical film. I've got a whole bunch of it. Here's my cervical film. I'm going to turn the camera sideways. Are you guys okay with that? Okay. So what I want you to look at is, here's my film, and what you'll see is the disc spaces in between, and here's what a normal film looks like. Look at the difference, guys. Normal film, my film. And this happened when I almost died in a car accident at 19, all this damage. So I've almost got no disc space left in a lot of my vertebrae. So a lot of my vertebrae are like this, where a normal vertebrae, let me show you an example here really quick. This is important because spinal pain is the worst. It's like a toothache in your back all the time. That's what got me into this work. So let me kind of show you the difference. So my vertebrae and some of my spaces in my neck and what a normal vertebrae looks like. You see the difference. Remember, the disc material is about 75% water. But people focus on the disc, even doctors do, but what they're failing to recognize in a lot of cases is there's all this muscle back here. All this soft tissue muscle that's here. And what's happened is my accident, as you damage soft tissue, it creeps and curls up. It's called creep. And it doesn't let the discs rehydrate when you get adjusted. So I get adjusted and it doesn't let these discs open up. So these ones here, they wanted to fuse at 19, 5 and 6. They haven't gotten any worse, but I'm not happy with where I'm at. Thank you. And this is what normal looks like. See the nice curve in the neck? See the nice disc spaces? Biomechanically, this spine is in really good shape. Hey, Scotland. So again, that's me. I'm currently 52 years of age, but this trauma happened to me when I was 19. So what they're going to do is they put me in a surgical setting. There's an anesthesiologist, an orthopedic surgeon, two chiropractic physicians who are trained in MUA, and they adjust me under anesthesia. So everything is super relaxed. And the goal is to begin to break down all this scarring in here to allow my spine to move more toward this direction. I'm never going to be this way. But if I continue on, this is going to become more problematic as I mature. Look at this disc is failing. My disc between 3 and 4 is failing here. So this is all scar tissue related at this point. You see? So a nice normal disc. So just give you an impact of the differences. Let me move these closer together on my screen. So this is at the office that I'm at They did an excellent job shooting the films. So just to give you an example of what normal is on the right in my disc, does your current surgery give you headaches? It gives me so many different types of pain. Headaches, numbness down my right arm. Right now I'm feeling it in my upper back. And I'm in really good shape cardiovascularly. But again, this is trauma that happened to me in my teens. And I got chiropractic care from then on, but my trauma was so massive. Remember, I was in a coma. I lost my bladder function. And they're going to do my whole back. My low back is just about as bad as this as well. So don't think your only option is surgery or spinal injections or more aggressive things. That's okay. Pain is a good motivator for all of us. We have different types of pain. So Amy, you know, you're in pain in a lot of areas because of your weight and other things. So we all have our own crosses to bear. Thank you. So fortunately for me, Dr. Seth and Dr. Kosmides are probably the, you know, they've been trained in MUA. They're probably the best on the planet, and they're going to be taking care of me tomorrow. Yeah, so this is definitely a good procedure to consider. Now you have to qualify for it. You know, I took many X-rays and did lateral bending studies where you actually bend under motion. So there's certain qualifications that you have to meet in order to be a candidate for MUA. So it's called manipulation under anesthesia. It sounds really harsh, but remember, if you've ever had any soft tissue work done where a massage therapist is pushing on your back or your legs and it's really painful, that's because you've got some sensitive muscle tissue in there that's fighting that. Well, under anesthesia, all that is taken away. It's all relaxed so they can work through that soft tissue without you being in pain. I'm sure I'll be sore afterwards, but I mean, my alternative is for this to fuse up on me, or they begin to inject chemicals into these posterior joints. Yeah, it does. And that's not, injecting chemicals into these joints is not going to fix the soft tissue damage. Do you see? It's a short-term solution. And this surface on these joints is 200 times smoother than ice upon ice. It's super slick stuff. So, again, this is my neck, the back of my skull. Beginning the front of my face is farther this way. The front of my neck is here. My trachea is here. Highway bone is here, and then here's the normal one. Look at the difference. My goodness. So that's why I'm opting for manipulation under anesthesia. So I go into the procedure tomorrow at 3 p.m. and I'm going to scope at the facility. It's in Arcadia. It's about an hour and a half from where I live. My wife's going to go with me. You know, you'll definitely be on drugs when you leave there because it's probably going to be painful. I'm excited. More so, I knew I needed this procedure years ago, and I've just now gotten on board. But thank you guys so much. So again, there's some people that say, oh, that's so aggressive, I can't believe you're doing that. But you have to understand what your options are and where you're currently at in the situation. Last thing I want them to do is go in there and fuse this surgically, because once you begin to fuse this and manipulate these joints, let's say we fuse this joint, the one above and below has to work 200 times harder. Within 2 to 5 years, those will fail. So do I really want to play that game? And spinal surgery is still considered experimental. So you have to basically sign off on, I'm open to this experimental surgery, and anything that happens that I take full responsibility for. I'm not ready to do that yet. So MUA is a good option for me. I'm looking forward to it. Yeah, that's unfortunate, Star. Yeah, I've been there at 19. They wanted to fuse me. Unfortunately, my dad, who wasn't medically trained, stood up and says, no way, you're not going to cut out his spine. So now you understand, Sally. Okay, so I wanted to do this. So this is the report of findings we give in our office. And have adjustments, have chiropractic care helped me? Absolutely, it's helped me. But you got to break down the scar tissue to give that disc a chance to come back. Because remember that you adjust, when you hear that noise, there's fluid rushing into the disc, so it opens. But when you have scar tissue like I have, it immediately closes it back down. I'm so glad that I'm trying to explain it simply. Why is that green on the right side? It's just the way they filmed it. That's all. Thank you, thank you. I think I'm going to try to scope at the facility after the procedure. I'll probably be a little bit groggy on medication, but I'm supposed to go out with a date with my wife tomorrow night, so we'll see if that'll happen. But you know, I'm expecting positive things. I'm ready for it. I've been working on flexibility this last week. I'm actually getting a massage right before I go. So I just want to get this scar tissue out of the way. Hey, Asif. So I focus on my health. The Lean Body 360 is all about that. So I've got that covered. But thank you. Yes. You'll get week 9. Don't worry. I'm going to work on it today. Don't worry. It's not like I'm going to be on morphine for weeks, not like that. No, it's just going to be, it's almost going to be like a hard workout, I think, is what you're going to expect to feel. But again, I have the best in the world working on me, so I'm very, very fortunate. Very, very fortunate. Hey, PG NYC. So again, if you're contemplating disc fusion or an invasive procedure, injections, consider MUA. And you're going to hear some initial probably negative things about it, but now that you understand this, and you can have them watch this replay, you're flying out here, great. It's just unknown. Orthopedists have been doing it for years with frozen shoulders, and the same concept. You're breaking down scar tissue. Yeah, it's painful, but what's more painful is what I'm going through as this tissue continues to creep as I age. And look at my spine. I've lost all of my curve. It's actually reversed. So the load is directly on the disc. It's directly pointing straight down on the disc. It's got to be that nice arc. So that's what I'm doing tomorrow. And again, it's in a facility in Arcadia, Smart Spine Center, I believe the name of it is. I'll scope from the front of it. And yeah, so your doc's taking his own medicine, both in my Lean Body 360 program and in my my spine, looking at things reasonably and rationally. It's the worst. I like to liken back pain as having a toothache in your back. So that's what it's. So I'm gonna turn my camera back now. So that's what it's all about. Lean Body 360. Yeah, I've got to get ready for that. So, yeah, I didn't get to any positions in my health because I had all these challenges. I almost died at 19. I was in coma, and this was the result of that. So, if anybody says, "Oh, I got an accident, I'm fine now," this is the result of me even getting chiropractic care for years. Imagine if I didn't get care. Major reverse curve from birth. I just gave on. Well, I'm going under manipulation and anesthesia tomorrow, but when she has a reverse curve from birth, I don't know how old is she now, but go get checked out chiropractically. Remember, we're looking at things from a spinal perspective, totally different. We're looking at mechanics and what can be changed. Remember, she's 27. Absolutely, yeah, have her go get checked out. They'll do some weight-bearing x-rays and see what's happening. You have to remember, orthopedists are looking at if it's broke, don't fix it. In other words, if it's not broken, everything is fine. My uncle was an orthopedist. After my accident, he said everything is fine, nothing's broken, you're just sore. And within a couple weeks, I lost my bowel and bladder function. So a chiropractor looked at it totally different. So again, not either person is right or wrong, just looking at the elephant from a different perspective, that's all. And again, if I had a disc fragmentation or some other complications, I wouldn't be a candidate for MUA. Not everyone automatically goes in and gets manipulated under anesthesia arbitrarily. It's a very methodical process, and it's a certification course that doctors had to take. And I took mine in 2011 because I was so intrigued that I had a feeling that someday this might be a tool for me. And when it comes to injecting my spine or cutting on my spine to naturally, artificially fuse me and getting MUA, there's no contest. So this is, I guess you could call this the most least invasive way to begin to correct my biomechanical situation. So anyway, I just wanted to scope out that. This is my part 5. It's so sensitive. It's like a toothache in your back. I'm having one right now in my lower back, and hopefully one of the docs will come in today to adjust me. What did he, after Chiro helped you, your uncle? What? He didn't say anything, which is pretty common. He had no comment for or against. He was pretty much indifferent, which is, I guess, their choice. Rather than embracing it and working as a team, he opted just to become indifferent, and that's okay. I'm here today. He passed away again in his early 60s from cardiovascular issues as well. So they've all taught me something. No, he's another one. That was another Uncle John. He died at 31. So I had very determined, stubborn Greeks in my father's side, and no one could tell them anything. And their lifestyle just put them in an early grave. So that taught me I can either follow that path and be like that, or I can change my attitude and do what works. That's why, like I said, I teach diabetes education, because I'm not I don't teach in a way, and my lean program is not in a way where it's for or against. It's what works, how's the physiology work in the body, and let's go along those means. And if it happens to fall this way, I don't control that. It bothers me that medical doctors don't. Well, not all. And it's, I'm indifferent to that non-recognition. That's certainly their choice. But the end of the day, what works and what doesn't. No question, I changed my attitude. And again, I'm not in charge of how people feel about me, nor should you folks be in charge of how people feel about you. It's totally irrelevant how people feel about you. It's more of, what are you doing now with my Lean Body 360 program? What are you doing now? What's my here's a tissue for your issues. Cry a little bit for 5 minutes and move on. And that's it. What are you sitting now? I'm just sitting on a chair in, this is the reported findings room. So this is where we go over patients' x-rays with them, much like I went over my x-rays with you. That's great. Thank you so much. I'm doing my best to have as much clarity and transparency as possible. I'm not perfect. I still have struggles too, but you have to address them reasonably and rationally. And that's what taking care of yourself is all about. You don't become fixated on one aspect. You say, okay, what's going to help me the most with the least amount of side effects? That's the key. So I hope that helped. I know some of you may not. Some of you may know someone with chronic back issues. It's definitely something to consider. Understand that initially, if doctors aren't trained in it or don't understand it, they'll give it bad press. But they're coming from a point of ignorance. And what you can ask them is, are you familiar with MUA? And if they say, what's MUA? Then you know automatically they're not familiar with it. I certainly wasn't in 2010. I thought it was a very radical procedure, but it's not. Okay, you have a diagnosis. Okay, the question is, what are you going to do about your MS? Lifestyle plays a crucial role in all chronic conditions. Don't be led otherwise. And don't blame your genetics. Don't blame your mom and dad. You can do something practically and pragmatically in any chronic condition. And I would say most genetic conditions can improve as well. Oh, you're so welcome, Amy. Remember, you're in charge of, your body is your ship. You're in charge where you steer it. You can either steer it down the road of symptomatic relief and being supported because you're ill, or you can go into another direction and say, okay, what am I going to do to improve my health? It's totally up to you. Totally in your charge. And it's not about me being harsh or mean. It's about saying, hey, you got to come to grips, because ultimately every day you wake up, you have to look at yourself in the mirror and say, okay, am I happy with where I'm at? If I'm not, what am I doing about it? I've got people in my Lean Body 360 program that are over 300 pounds. They're doing something about it. Okay, they're fat. They're fat, then they move on. You have MS, you have MS, okay, you move on. Okay, what can I do to not be MS dependent? You're the conductor of your train. That's right. And it's up to you what track you go down. I enjoyed the replay of your breakfast shake today. Thanks to, oh, you're welcome. You're welcome. Very, very impromptu. This is more a serious medical discussion because back pain is rampant. 80% of all men have low back disc problems that in part can affect their organ function. So health is underlying foundation to all conditions. No question about it. So we all have, mine was spinal trauma, a bad accident when I was 19, and other people was different things, but you have to take a pragmatic approach of how you deal with them, and you're ultimately in charge. No question cleaning helps, no question about it. And just keep ramping up your, I don't know if you're in the Lean Body 360 program, but my goal is to teach you beyond what you see in the media. Really get to the brass tacks, because a lot of the stuff out there, quite frankly, is utter nonsense. Colorful polo. Yeah, well, I'm in the office today, so I'm a little bit more conservative, but I'll get back to those. Today was blue day, so I wanted to wear my blue shirt today. Some side effects get removed, others get better. It's the easier and painless place to start. No question. Yeah, like Asif said, he dramatically changed his lab work in a little 7 weeks. One thing at a time, do it consistently, and just gain momentum. Thank you so much. I don't think anything negative is going to go wrong, because again, no one's cutting into my skin, no one's injecting anything. They're just adjusting me under anesthesia, so I'm totally relaxed. And I'm like a Pavlov's dog. I'm so anticipating it, because when you're in back pain, and it's hard, The best way I can explain having back pain is having a toothache in your back. If we all, how many people on this scope had a toothache in their life? I do. I feel it. I feel so much love from all you folks. This was one of the best media things that I've done in my life, is being on Periscope. Thank you so much. And partly the reason why I'm having this procedure, you have to get out of pain, but I have to step up to the plate. I have to step up. Resolve my pre-diabetes, high cholesterol, normalized above normal. That's right. And it was like water off a cat's back, the way he did that. He just followed the steps. So don't get caught up, oh, I have high blood pressure. Okay, you have high blood pressure. The next question is, what I want you guys to think in your mind is, when you have these diagnoses, what are you doing about it? If you're just taking a pill and carrying on with your normal lifestyle, you're not doing anything about it. You're putting your responsibility on the pill and the doctor, and that's not going to resolve the issue. Thank you. I can be tough sometimes, though, because I care. You know, I lost my dad at 56 in a real important time in my life. I was in practice like 5 years. I had no idea what I was doing with my, business or my life or anything. And he was just gone. Poof. Just no warning. Remember, his medication managed his blood chemistry for the last 10 years of his life, both diabetically and blood pressure and cholesterol, but it didn't improve his health. That's what I want to get forward. I'm not against anything. It just didn't improve his health. That's the key. Yeah, diagnosis. Remember, diagnosis, if you break the word down, di means two. Agnosis is Greek for don't know. So it's a guess. Even the Mayo Clinic, by their own admission, is right about 50% of the time. See, that's it. Toothache in the back. To me, it's a perfect description. All docs' advice. I took one small change at a time. It's now a life journey. Now I'm changed. Yeah. Yeah, and again, once you're motivated, once you gain some traction and momentum, dis-ease, that's no question. The body's out of ease. And when you're out of ease, you normally do things and crave things that you wouldn't. So it becomes a vicious cycle. And anyone says, oh, you have bad skin, your intake of food doesn't matter, they're back in the 1940s, in my opinion. They're not basing that opinion on scientific research. They're basing it on their judgment, and their judgment, in my opinion, is poor. And it's not a knock on them. It's sitting there looking at the peer-reviewed data. And again, I teach this work to doctors for their credit hours, so I have to know what I'm talking about because I look at the research. If food doesn't matter, then what does? That's correct. Nutrition is key. Your emotional state is key. Your attitude is key. Bye, Christy. That's my wife, guys. Follow her. She's a phenomenal artist. That's right. And Amy is a perfect example. She scopes almost every night. She was almost 360 pounds. Now she's 3 in teens. She's in the teens already. And my goal is to get her to 300 with a huge drop in body fat before December 1st. And she's going to get there. Amy, start that soup Monday. Get back on the soup on Monday. I troll Chris as much as I can. I know a lot of you guys are not in California. You're 318, so you dropped another pound. Phenomenal. You're going to start reading. Just give it time. Remember, you've been, morbidly obese for years, so just give it time. It's okay. You're shedding that skin. You're like a snake. You're just shedding, or a butterfly. You're just shedding your cocoon. So don't worry. Don't even just water off a cat's back. That's all that is. You are a teen. That's right. Great patience. Anyway, but thanks you guys for watching the replay. Thanks for your hearts. They're all appreciated. You guys got me close to 2 million now, based on my scopes, and I'm so thankful that you guys find value in what I do. Tonight, I'm going to try to scope about 9. If I don't, I don't know why, but I should be. But I might be on late. I'm not sure. My procedure's at 3. I'll probably get home by 6. Probably take a nap a little bit, and I should be okay. But thanks. Hopefully I won't need any luck. It'll be all skill and preparation, but it's always nice to have positive thoughts. So thanks, guys. I've got to get to work on week 9 before Amy harpoons me. I'll get that done, and I'll talk to you guys soon. Thanks for watching the replays. Thank you so much. I'll scope on the way to the facility, at the facility tomorrow. So if you can, jump on, watch the replay. We'll probably get there about noon, and Chrissy's going to set up her camera. My videographer is going to come, and it's going to be a documentary on MUA and how a doctor undergoes the procedure and why I chose to do it. So it's a little bit different perspective. I'm a patient, but I'm also a chiropractor, and I'm also certified to perform MUA, so I'm going to have a unique perspective. So the doctor takes his own medicine, which, quite frankly, is rather rare in these days. Anyway, I'll talk to you soon. A lot of love. Thank you guys so much, and bye-bye.